Corpus Christi City Manager, and we have a new format today, which is just myself who will be conducting the press briefing. Tomorrow, Tuesday, and then on Thursday, unless otherwise warranted, Mayor Joe McComb and Nueces County Judge Barbara Canales will be joining myself tomorrow, as well as Thursday. So today, what we're going to update the community on is our daily update on the number of COVID cases in our community. I'll talk to you about the drive-through testing collection event that took place this morning. And we want to remind you about the CDC recommendations on wearing masks and give you some information there. I want to highlight a message that we released, or I released, to all 3,000 city employees today, in case any city employees are watching and haven't had a chance to check their emails yet. Just wanted to bring this to their attention. We'll begin to talk today, and there'll be more information on this tomorrow, on a small business recovery program that the City Council is scheduled to consider tomorrow to help the many small businesses out there that are impacted from the COVID-19 situation. And then we want to talk to you about a trending model that we have been developing, actually that Texas A&M Corpus Christi has been developing. This is new, and we expect to have it by Friday, but I'll give you some detail on that. And then we'll finally close by showing you the zip code map, and I'll talk a little bit about it, that shows of the cases from yesterday, or through yesterday, where they reside within Nueces County and what zip codes. Okay, so with that, we'll begin with the statistics. This is an update from yesterday at 4 o'clock. Over the past 24 hours, the county of Nueces has seen another 6 positive cases. 4 of those test results came from our lab, and then 2 came from the private sector, private labs. So we had 53 cases yesterday around this time. Today we're up to 59 cases in Nueces County. Still no deaths to report. The male-female gender split is still about equal. There's now 51% female, 49% male. The 6 new cases were predominantly male. There were 5 male and 1 female. The age bracket we have beginning from 0 to 19, and then about a 10-year spread all the way up to 90 plus. So in those various categories, just about every category now, with the exception of the 90-plus-year-old, has at least 1 confirmed case of COVID-19. And when you look at this, it's not just an elderly person situation. In fact, 60% of all the cases confirmed today are for somebody that is 49 years of age or younger, right? So somebody 0 to 49 years of age, 60% of all the cases are there, 34 in total, and then 40% is in that elderly bracket. No, not elderly, but the bracket from 50 to 90. We're getting better data in terms of tests performed in our community, and with more information from the hospitals and the private testing labs, the commercial testing labs, we have done in our community a total of 758 tests have been performed in Nueces County. So that's good, because about a week or so ago it was a much smaller number. But as we test more in our lab, we've tested 323 specimens, and the private sector through the hospitals and some of the commercial testing sites have performed 433 tests. So a little over 750 tests conducted in our county area to date. And then of the 59 cases, the majority obviously are within the city of Corpus Christi. There's 52 in our city limits, 1 in Robstown. There's 2 now in rural unincorporated Nueces County, and 4 in Port Aransas. And then finally, a quick update on the disposition of where are the people. Again, the majority of the folks are at home recovering. We do have more, though, than what we had last week in the hospital. So as of today, 6 individuals are in the hospital. 2 remain in critical condition. 1 is improving, and 3 were recently added, and we're not 100% sure of their disposition, but we know they're in the hospital. So with that, we'll do a quick translation, and I'll move on to the next item.
Okay. La información más reciente sobre los resultados positivos. A la fecha son 59 los casos positivos a la presencia del virus. No se han reportado muertes debido a este virus. De los 6 casos nuevos, 5 son varones, 1 es una mujer. En total se han realizado 758 pruebas a cabo en nuestro laboratorio y en los laboratorios privados, esto solamente en el condado de Nueces. De los 59 pacientes, 6 pacientes están hospitalizados y el resto se encuentra en su casa.
Okay, let me give you a quick recap on our drive-through testing. So we had a successful event again this morning. We had 28 patients go through the Christa Spahn Former Hospital's parking lot drive-through. 28 samples were collected. Our next drive-through will be either Wednesday or Thursday of this week, depending on the number of persons that are pre-screened and cleared for the testing. That will begin at 8 o'clock, either Wednesday or Thursday. We do, though, want to remind everybody that we need to ensure we're practicing our spatial distancing and our staying at home practices. This is critical, and today is only the first couple of days into the month. We have all the way till the end of the month to go, so keep practicing those things to include staying at home and social distancing. On Friday, the Center for Disease Control recommended masks to be worn in public spaces. And homemade cloth masks can be used in public settings if you don't have access to a more professional type mask. Some of the places you might want to consider wearing a mask include grocery stores, doctor's offices, or pharmacies. The recommended masks can be made with cloth covering, made from products you can find in your home. We do have some information on our website on how those masks could be made and how to wear them, and that type of information. It's on our coronavirus website at cctexas.com/coronavirus. Masks, though, we do want to caution, are not the only way to protect yourself from the coronavirus. We need to continue to wash our hands as a practice many times a day. And we do need to continue to not touch our eyes, nose, or mouth with unwashed hands. And it's important to social distance 6 feet or more. That doesn't matter if you're in a public setting, even outside, you should be doing that. Keep away from folks' breathing area where the virus can be transferred in the form of a droplet. We'll take a translation on this, and then we'll go to the next item.
El día de hoy se llevaron a cabo un total de 28 pruebas para la detección del coronavirus. La próxima toma de muestras se va a llevar a cabo a mediados de semana. Con los reportes por transmisión comunitaria en el condado de Nueces, tenemos que asegurarnos más que nunca que los residentes practiquen el distanciamiento social o que se queden en casa si es posible. El pasado día viernes, el Centro para el Control de Prevención de Enfermedades recomendó el uso de máscaras faciales en lugares públicos. Las máscaras de tela casera se pueden usar en lugares públicos donde a veces el distanciamiento social es difícil de mantener, como en supermercados, consultorios médicos y farmacias. Las máscaras no son suficientes para evitar contagios, son solo una capa adicional de protección. El público necesita continuar lavándose las manos, no tocarse la cara, los ojos, la nariz o la boca con las manos sin lavar. También queremos que el público sepa que las máscaras N95 deben reservarse para los trabajadores de la salud y aquellos que están enfermos. Para más información, visite la página www.cctexas.com/coronavirus.
Okay, great, thank you. The next item I'd like to cover is a message that we delivered today to all city employees. And earlier today, I released a video as well as a letter to all our employees. We have over 3,000 employees in the city of Corpus Christi. And I wanted to make sure we know that we have them in our minds and we're thinking of them. I know they can feel disconnected, especially if we're not working here at City Hall. But we're here, and we have you in our best interest, and we know that together we're going to get through this. I especially want to recognize those that are working still, like our water department staff, our city county health district staff, our frontline police and firefighters are still constantly on the job, and we know that by working to serve the community, you're sacrificing yourself and your family to get us through these times. So we're extremely appreciative of that. I know the community is, and my message and video that was shared today is in part to let you know that we know that and that we're thankful for that. I also noted in the video and the letter that we've done things in our business processes to safeguard you and your families if you're still working in your workplace, if it's an essential work function. So we've adjusted confined workspaces to meet public health and safety guidelines, and that includes teleconferencing. We have many employees that are working from home today using WebEx, the telephone, and other telecommunication measures. We've initiated a new travel policy to reduce travel and get better information if people do travel. There's certain things that they need to do now to stay away from the job if they volunteer to travel somewhere that is an issue, an area that may have high cases. We've increased cleaning protocols at all our facilities, and we're providing daily updates today, as this here is, and other means of communicating to our employees daily. We know that we're a powerful team of over 3,000 employees, and so we know that we're a resilient community. This is a community that has weathered many hurricanes since dating back to 1800s, and we're still a great community, and so we know we can overcome this, and we want you to know that together as a team, we'll get over this, and we want you to know that the community appreciates what you're doing as city employees.
Hoy dimos a conocer un video en donde entregué un mensaje para nuestros más de 3,000 empleados. Estamos seguros que juntos podremos sobrellevar esta situación. Mientras estamos trabajando, sacrificamos muchas cosas, pero sabemos de su sacrificio. También envié una carta a los empleados en donde establecemos reglas que reflejan las normas estatales, así como otras normas si tienen que viajar. Todas las instalaciones están también siendo desinfectadas. Todos en equipo trabajamos mejor.
Okay, good. Okay, our next item will be an update on our small business recovery program that we're working on to present to City Council tomorrow. And tomorrow at the City Council meeting, and then after there'll be much more information, but this is an important one for those small businesses out there that are suffering through this time. So what it is the city is making available $1.7 million in small business loans for small businesses, or loans for small businesses, I should say, $1.7 million. We are going to contract with an entity called the LIFT Fund Inc., and we have a 15-year relationship with the LIFT Fund. They're a pretty big organization that's in numerous states in the southwestern region here of the country. They are a community development financial institution. And the way the program will work is that the loans will be up to $25,000 per small business. And so a business can take out a lesser amount if they'd like, but it can be up to $25,000. It'll be for a 3-year term. The loan payments will be for a 3-year term. There'll be 0% interest. That's the benefit of this, 0% interest, and no payments for the first 4 months. Funding is expected to be given to the small businesses 8 to 10 days after the loan application is completely submitted. So that's another positive, is that it's quick turnaround time. What is a small business and who is eligible? So for this program, a small business is a business that has annual gross revenues not more than $5 million. And to be eligible, a business has to demonstrate loss of revenues of at least 15% since March 1 of 2020. I do have a telephone number here, and we'll share this again tomorrow, and there'll be a website that'll be available on how to apply by Friday. But the telephone number I want to share now in case businesses want to give the LIFT Fund a call to see what type of information should they start getting together so that they can get their application in as soon as possible. And so that number that you're going to call, which is a LIFT Fund representative right here in Corpus Christi, is 888-215-2373. It's on the screen here. 888-215-2373. So that's the number to be called to get a business representative from the LIFT Fund who can provide you more information on the small business loans that will be made available should City Council approve the program tomorrow. Our council meeting will be at 9:30 in the morning.
En cuanto al programa de recuperación para pequeños negocios, van a haber 1.7 millones de dólares disponibles mediante la organización Live Fund. El programa trabaja mediante préstamos de hasta $25,000 por un término de 3 años a un interés del 0%. El primer pago se hace después de los primeros 4 meses y el préstamo se recibe en alrededor de 10 días. Para ser elegible, el negocio debe demostrar pérdidas de más del 15%. El teléfono a llamar directamente para una aplicación es el 888-215-2373. Se espera que el concilio el día de mañana realice una votación en cuanto a este programa.
Okay, next, let me just give us a quick update, and we'll have more information on this as the week progresses, but we want to let the community know that we're interested in modeling our case projection here, the curve. Everybody kind of knows what the curve is. And the federal government has the curve. We've heard a lot of talk about the curve, but locally we're developing a curve, and we've asked Texas A&M Corpus Christi to help us with that, and they without any hesitation agreed to help, which is great. Dr. Miller and Dr. Mahdi of the university have assembled a research team, and together with some of our city staff, we've begun in earnest last week to develop modeling that'll help us project the number of infections that we'll see in our Nueces County and to some extent in the counties surrounding ours. This curve is going to be important, and I'll tell you why in a few moments, but I did want to recognize some of the professors and distinguished professors, I should say, that have been working literally around the clock since last Thursday. That includes Dr. Tissot, Dr. Huang, and Dr. Bird of Texas A&M Corpus Christi. It's been a great team. They've been really energized and putting a lot of commitment into this. They are today identifying several reputable models from across the world that have been used to model COVID cases. They're looking at numerous ones and plugging data in and seeing how each model responds, and they'll determine what is the best model to use for us by Friday. They're basing the curve, obviously, based on our demographics in our area. We're different than New York, say, or Italy. And so that's some of the work they're doing. We expect to have the curve model by this Friday, and we will be sharing that with the community. The model will show us the impacts and the benefits of some of our orders that all the way from the president to the mayor and County Judge Canales have put in place. And so we're going to be able to show you, and we're going to show you that it matters that we social distance and that it matters that we're staying at home. And so the model will help us to show you that. We're going to show you what if we didn't do these things, where would the curve be and how high would it be? And so that's an important part of why we're asking for the model to be done. We'll also predict where is the peak of the infection rate. You saw earlier the numbers continue to come in at a pretty steady clip, but we want to know where is our peak infection rate, and do the policies that we're putting in place, can they spread that peak and flatten it and put it out into the future, allowing us to have better resources at our hospitals and other supplies to treat those that need the help. We'll also be able to use the modeling to show what if we do more social distancing or extend stay-at-home orders, what would that look like? Or should we put in other practices to help flatten the curve? It will also, in the modeling, show the impact to hospitals, hospital stays, as well as deaths that may occur as a result of COVID-19. So the curve model, again, being produced with the excellent leadership from Texas A&M. We can't thank Dr. Miller enough, and those 3 distinguished doctors that are working feverishly to get us a model. We talked to them today in a WebEx call as one of the first engagements with them. Judge Canales and myself did, and we'll regroup with them on Wednesday. And then hopefully by Friday, we'll begin to be able to roll out some of the modeling for our community.
Queremos que la comunidad esté informada sobre la curva en nuestros modelos de información sobre el virus. Un grupo de la Universidad Texas A&M de Corpus Christi está trabajando en un modelo para analizar los casos por coronavirus a nivel local. Con este modelo se tendrá información sobre casos, población y expectativas. También se te dará información sobre los resultados que han tenido las órdenes estatales y locales. Se podrá detectar los casos pico y rangos de infección, estaremos más preparados en los hospitales con recursos. Esperamos tener este modelo a finales de esta semana.
Okay, great. Okay, and then the final, the final part for my presentation today is a display of COVID cases that are confirmed positive across our county in terms of zip code. And so this information has been asked for by several in our community, and we finally have the model ready. This map that you see on the screen today is, if it's not on there, it will be on our COVID-19 website. It's on there, our coronavirus website, the joint city-county website that you can find on going to either page, either our homepage or Nueces County's homepage. There'll be a link to get you to this map. The map, and what I'm going to tell you is as of yesterday's numbers, so it had a total of the 53 confirmed cases, and we know that today we're up to 59, but this map demonstrates or portrays the 53 cases. So you probably can't see it that well from here, but the key thing is that the majority of the cases in the are in two zip codes on the south side. So the south side, two zip codes 78413 and 78414 has 15 of our confirmed cases. The second highest area is going to be along Ocean Drive in the Bayfront. Those three total 13 confirmed cases. So zip code 78412, 412, 411, and 404. Those combined have a total of 13. And then the third highest area is in our island area, including some of Flower Bluff, two zip codes totaling 11 cases. Those two total 11. So the preponderance of the cases are in those three areas. As you move to the west side of town and the north part of town, there's still cases, but fewer compared to those other areas. So this information is used as a tool. It's not meant to disparage any neighborhood or anybody. It's just factual information. It's meant to help us be aware of where we are in our surroundings, and that's why no matter where you live, whether there's one or three cases, the key thing is to stay at home as much as possible, social distance, because we know we have 60 cases, almost 59, within Nueces County. And so the tool is meant to help us better understand the facts that we have and the situation that we have in our county. This map shows just about all the counties in Nueces. There's 13 shown on here, and it looks like it comprises just about all of the county. But just as a note, there's a total of 37 zip codes in Nueces County. And so while 13 are showed, there's several more that have 0 cases. So 13 of the 37 zip codes have cases in Nueces County. So that map will be, or is on our website already, and will be updated more regularly as our cases change in our city.
Contamos con un mapa de información. La comunidad ha estado preguntando por la zona geográfica en donde se han reportado casos positivos del virus. Contamos con este mapa con el número de casos por cada zona postal. Los códigos postales 78413 y 78414 cuentan con el mayor número de casos. En el área norte de la ciudad se reporta un menor número de casos por el virus. Lo importante es estar en sus hogares y evitar el contagio. Este mapa es solo para saber y entender en dónde se encuentran los casos. El mapa está disponible en el portal de la ciudad y va a estar siendo actualizado en cuanto recibamos cada cifra por cada zona postal.
Okay, that concludes our briefing for today. Let me just remind you that tomorrow we'll have updated numbers again. And with me tomorrow will be Mayor Joe McComb and County Commissioner Barbara Canales. We may also do a separate press briefing on that small business recovery program. So keep an eye out for that. If not, we'll cover it at the 5 o'clock briefing. City Council will meet at 9 o'clock tomorrow. One of the items that they'll consider that Mayor McComb has put forward is a potential prohibition or I guess you can call it prohibition on short-term rentals for non-essential businesses and non-essential activities. That may be discussed tomorrow at our city council meeting. We'll also talk about the orders that we're updating to be consistent with the state governor's orders and the judge's orders in the county. And then we'll also consider that small business recovery program. So that starts at 9:30 tomorrow. So with that, I'm available for any questions that you all might have.
So I know on Friday the number we were told were 3 people have been considered recovered. Do you know if that's changed at all?
You know, the recovery, we checked earlier today on the recovery. I don't have good data on that, but it's something that we're going to begin to focus on. We'll show it graphically because the 59 cases, some of those go back to when we first started counting. So at this point, there's a few people that have recovered, but we'll begin to show that. So I don't have any update on that today. Yeah. Okay, good. Thank you, everybody.